Okay, so there you go. We will now be starting with our topic for this afternoon. And again, we'll be starting with the chapter 12, which is the heart, and then the 13, which is the blood vessels. And we will be starting with this one. So we will be talking about the components of your cardiovascular system, in which we already started. I already started finishing or discussing to you the concept about the blood. So we will now go directly with your heart and also your blood vessels, in which this concept is very important, especially in learning the anatomy of the heart and realizing or the when you go to the abnormals of the heart, it's easier for you now to assess the patient. Okay, and let's start first with the functions. So if we say the functions, these are the things that our heart is doing in order for us to survive. So the first one here, it says it regulates the blood pressure. Now, how does the heart regulates the the blood pressure? I mean the blood supply in our body, because the tissue in our body has various metabolic needs, in which you already learned your metabolic or your this concept in your how do you call this one, in your previous, I think this one is in chapter 3 of anatomy and physiology, and also in biochemistry. Okay, so our body has a various metabolic needs, and the heart will match the blood flow to address the changes that is happening in our body. Kumbaga, nasusuplayan niya lahat ng part ng ating katawan. The next one, it generates the blood pressure. Because of the cardiac muscle, we've learned this one already, the heart will keep on contracting. It will undergo contraction. Now, with this contraction, which will generate the blood pressure. And then with the blood pressure, it will now push the blood to your bloodstreams. So that is generates blood pressure. Next one is route or routes the blood. We have here the pulmonary and your systemic circulation, in which we will talk later on. So in pulmonary, the right side of the heart pumps blood to the lungs and back to the left side of the heart. On the other hand, the systemic, the left side of the heart pumps blood to all other tissues of the body, and then it will go back to the right side of the heart. And the last one here, it ensures one-way blood flow. So the valves of the heart, we will be talking about this one also later on. Um, they will ensure that there are no traffic. There will be no traffic that will happen with the blood flow in our heart and also with our blood vessels. So these are the functions of our heart. Now, the next one here is we will be talking about your heart characteristics. So please find time to read this one for a while. Okay, so let's go back. So here, the characteristics of the heart in terms of shape. If you're going uh, to uh, to check your fist, the fist of your hand, that's the actual size, or it's near that size, the size of our heart. And it says here that it weighs less than 1 pound. The location of our heart is between the lungs and between the lungs in your thoracic cavity. Remember that we've talked about the thoracic cavity before. In between, you can find the heart. The orientation of the heart, the bottom part, this is what we call the apex, okay, towards the left side of the body. They're saying here that physically active people have larger heart, and when we reach the age of 65, heart will decrease in size, especially that we are already old, we are a bit inactive. Okay, so this is with regards to the heart characteristics. Now let's go to the next one, which is your heart covering. Okay, we've already learned a lot of terms with covering. Okay, so the first one here, what we call your pericardium. Okay, remember again the word peri, the word peri means around, right? So if we say pericardium, it is double layered sac that anchors and protect the heart. As you can see here, this is your pericardium. And then itong nasa pinaka labas na part, yan yung tinatawag natin na pericardium. So meron din tayong tinatawag here that your parietal pericardium, which is this one. The blue line here, this is the membrane around the heart's cavity. And then your visceral pericardium or your epicardium, the membrane on the heart's surface. So ito na yung sa mismong heart natin. Now, in between your parietal and also your visceral, that is what we call your pericardial cavity, which is the white part here, okay? The outermost lining of the heart, your pericardium. Next to your pericardium, your parietal pericardium, and then the space, which is your pericardial cavity, and then susunod na yung visceral pericardium. Okay, that's how are you going to dissect the covering of the heart. Okay, let's move here. How about the layers of the heart? Okay, in terms of the layers of the heart, just like this one, just like our typical skin, they also have, you know, layers. So the upper part here, this is what we call your epicardium. Okay, epicardium, the topmost layer of the heart, which is on outside. Okay, a bit outside. Here, yung pinaka-chunk or yung pinaka-malaking part ng ating heart, that is what we call your myocardium. Your myocardium is thick middle layer composed of your cardiac muscle. Okay, and then here, parang subcutaneous part, kumbaga sa skin, that is your endocardium, which is the smooth inner surface. So if you're going to compare this one with our skin, so this is like your hypo, this is epidermis, this is dermis, okay, or subcutaneous. But in our heart, the upper part, that is your epicardium, middle part, your myocardium, and then endocardium is the base part of the heart. Are we clear so far?
Yes, sir.
Yes, sir.
Yes, sir.
Okay, very good. So this one is a microscopic picture or illustration of our heart. You can find this one, I think, on your book. No, I don't think it's in the book. Well, anyway, so this is your cardiac muscle. It says here that it has one centrally located nucleus, which is this one. The purple part here, this is your nucleus, and it has branching cells. It is rich in your mitochondria. It is striated, so it has your actin and your myosin. Okay, it has calcium ions and ATP used for contraction, and it has intercalated disc connected cells. Okay, so this is the broader or more specific rather illustration of your cardiac muscle. Now let's go here. Let's now talk about the chambers and hindi ko nagsabi na chamber ng Harry Potter. Chamber and blood vessels. So we have here your 4 chambers. You have your left atrium here, your left ventricle, right ventricle, and also your right atrium. Okay, and we have here your coronary sulcus. Your coronary sulcus, this one, the one in yellow, that is, it separates your atria from your ventricle. Okay, so here we have your left and right atrial or atrium, and here the one that separates it is your coronary sulcus, and then sa lower part ng heart is yung ating ventricles. Okay, so we have again your LA, your left atrium, RA, right atrium, LV, left ventricle, and then your RV, which is your right ventricle. Now let's talk about first about your atria. So this is the upper portion, holding chambers, small, thin-walled, contract minimally to push blood into your ventricles. So as you can see here, we have two atrium, which is the right and then the left, and it is separated by your interatrial septum. Okay? Tulad din yan dito sa baba, yung left and right ventricle, it is also separated by a septum na tinatawag natin na interventricular septum. But here in the atria, we have your interatrial septum. Okay, again, this one on this part of the heart, they contract minimally and they will push blood into your ventricles. So dito sa taas, pababa, just like also here. So that is your atria. While your ventricles here, it is the lower portion of the heart. This is the pumping chambers. It is thick, strong walled, and contract forcefully to propel blood out of the heart. Okay, so from right atrium, i-receive siya ni right ventricle. So here on this part, dito na yung pumping chamber. So dito yung mas malakas yung pagpitik ng ating mga puso. And then again, it is separated by your interventricular septum. So this is your atria, left and right. In the middle, interatrial. Ventricle, also left and right, bottom part of the heart, separated by your interventricular septum. Now, let's talk about your valves. For sure, maybe, or not yet, you heard about this one. Ito yung tinatawag natin na valves. A while ago, we already talked about the one-way kind of blood flow. That is because of our heart valves, okay? Structures that ensure one-way blood flow. So we will be talking about this one by one. So meron tayong pulmonary valve, meron tayong tricuspid valve here, and then your aortic valve on this part, and then we also have your mitral valve. Okay, let's start first dito sa may atrioventricular valve. Okay. This is between your atrial, this one, dun sa upper part, and then yung lower part natin na ventricles. So meron tayong tinatawag na tricuspid valve, which is this one. So as you can see here, it has 3 cusps, 1, 2, 3, okay? So this one, this is in between your AV valve and between your RA and your RV. Okay, so the blood here, dadaan siya dito sa may tricuspid valve, papunta sa may right ventricle. Okay, another thing dito sa ating atrioventricular valve, this is what we call your mitral valve. If you're going to compare here, they only have 2 cusps. Okay, so your this is between your LA and also your LV. Okay, this one is clear so far about your atrioventricular valve.
Yes, sir.
Yes, sir.
Okay,
Yes,
very
sir.
good. Ang tatandaan nyo lang dyan sa may upper part. Okay, yung right atrium and then right ventricle, left atrium then left ventricle. Tricuspid, from the word itself, meron siyang 3 cusp. Bicuspid dahil dalawa lang. Or we also term this one as your mitral. Now let's move here to the next one. Okay. So here, what is happening here that these valves, yung pinag-usapan natin kanina, yung tricuspid at saka yung bicuspid valve, they allow the blood flow from the atria or the atrium or aorta here and then into the ventricles. Okay? So blood here, papasok siya dito sa may ventricles. Okay? But prevent it from flowing back to the atria. So dapat walang regurgitation na nangyayari dyan. Dapat hindi magba-block flow yung dugo. Okay? So when the ventricles relax, this area, kapag magre-relax tong area na ito, the higher pressure in the atrial forces yung ating AV valve na mag-open. Pag nag-open yon, blood flow, the blood flows the atria into your ventricle. Okay? So ito, kung ito nag-relax, that's the time na ito magpa-pump siya ng blood. So pag nag-pump ito ng blood, itong valve na ito is mag-open. Tapos mag-flow na yung blood papuntang ventricle. Okay? With that, meron tayong tinatawag na chordae tendineae. Okay? Or here, it is the low, tension low. This one, they attach to AV valve flaps. As you can see this one. So itong attachment na ito. So they support yung valves para sa pagpasok or paglabas ng blood. Okay, that is the main function of your chordae tendineae. Now here, we also have what we call on your semilunar valve. So kanina ang pinag-usapan natin is yung atrioventricular valve. This time yung semilunar. So yung valve natin, it has two types. First type is your atrioventricular. Second is your semilunar valve. So we have here your pulmonary and also your aortic. Okay? So your pulmonary base of your pulmonary trunk. So ito yung trunk natin. So nandito siya. Your aortic naman, here, base of the aorta. Okay? Now, tingnan din naman natin ito. So what is happening here, when the ventricles relaxes, the pressure in the aorta of the pulmonary trunk are higher than the ventricles. Okay? Kapag nag-relax ito, ating ventricles, yung pressure sa aorta and pulmonary trunk natin are mas mataas. Okay? Now, the blood flow back from the aorta or pulmonary trunk towards the ventricles. And then, mag-open or mag-enter siya sa pocket natin, so yung sa ating mga caps. Okay? Causing them to bulge toward and meet in the center of the aorta or pulmonary trunk. Now, they will now close the vessel and blocking the blood flow back into your ventricles. Okay? So let's go here. What happens when the bicuspid valve is open? Kapag naka-open yung bicuspid natin, the blood flows from your left atrium into your left ventricle. Your aortic semilunar valve will close. Now the tension on the chordae tendineae will be low. How about here? What will happen when the bicuspid valve is closed? If the bicuspid valve is closed, the blood flows from left ventricle into your aorta. Your aortic semilunar valve will open. Now the tension on the chordae tendineae is high. Okay, how about the next one? Okay, so here we will now be talking about the right side of the heart. Okay, in the right side of the heart, we have what we call your pulmonary circuit. Carries the blood from heart to lungs. And blood is oxygen poor carbon dioxide is rich. As you can see here, the color blue illustration. So here, so this is the heart, and then this is your pulmonary circuit. Okay, so the blood here from the heart, it will travel here, and then it will go to your lungs. Okay, so that's how the pulmonary circuit works. And here again, remember, yung blood na nandito sa pulmonary circuit natin is mababa yung oxygen level pero mataas yung kanyang carbon dioxide level. Okay, and that's the time na ito na yung i-expel ng lungs natin. Okay, that is your pulmonary circuit. So let's talk about this one. Yung meron tayong tinatawag here na yung right atrium natin, it receives the blood from the three places, yung superior and inferior vena cava at saka yung sa ating coronary sinus. Okay, remember napag-usapan natin yung positioning of the body or anatomical position. If it's superior, it means sa may taas, and inferior, it means sa may baba. So these are your great veins na tinatawag natin. The one on the upper part, that is what we call your superior vena cava. And the one on the lower part, this one, this is what we call your inferior vena cava. Okay, and here, as you can see here, they are branching out. Okay, that is what we call your pulmonary arteries. So, yung superior vena cava, itong color blue sa may taas, it drains the blood above your diaphragm. Okay? Above the diaphragm, ano ba yung mga nandoon na kailangan may blood supply or kailangan madrain yung blood supply? They are your head, your neck, your thorax, and then your upper limb. Okay? The superior vena cava, they drains blood above diaphragm, which are your head, neck, thorax, and upper limb. Now, punta tayo dun sa may inferior naman, sa medyo lower part. Okay? So, ito naman, it drains the blood below your diaphragm. And below your diaphragm, there are your abdominopelvic cavity and yung ating mga lower limbs. Okay? Here, itong right atrium na tinatawag natin dito, siya naman yung nag-open into your pulmonary trunk. Okay? As you can see here, right atrium here, this will open this one. Kumbaga siya yung gate or portal niya. Okay? Papunta dito. Yung blood, yung gate niya is yung right atrium papunta sa may pulmonary trunk. Okay? Now, the pulmonary trunk, it splits into right and to your left pulmonary arteries. Okay? So, kung yung right ventricle natin, right ventricle dapat. There you go. I'm sorry. Ito pala. Si right ventricle, ito yung mag-open dito kay pulmonary trunk natin. So right ventricle, it will go here, going here to your pulmonary trunk. Okay, again, si pulmonary trunk natin mag-split into your left and right pulmonary arteries. Ngayon, si pulmonary arteries, siya na yung magkikarry ng blood away from the heart, going to the lungs. Nakuha ba yung part na ito?
Yes, sir.
Okay, very good. So, let's just have a quick recap here. Yung right atrium natin, this one, magre-receive siya ng blood from your superior vena cava, inferior vena cava, and then yung ating coronary sinus. Now, yung superior vena cava, ito, yung vein natin dito, i-drain naman niya yung blood above your diaphragm. And above the diaphragm are your head, neck, thorax, and upper limbs. Yung inferior vena cava below the diaphragm. So yung ating lower limbs, yung ating pelvic cavity, abdominal cavity, yung mga yan, or abdominopelvic cavity. Pinag-isa na nila. Okay? Now your right ventricle, this one, portal of blood going to your pulmonary trunk. Si pulmonary trunk magi-split into two, magiging left and right arteries. Yung magiging connection niya. Tapos itong si left and right arteries or pulmonary arteries, siya na yung magkikarry ng blood away from the heart, going to the lungs. Okay? Now going here, I mentioned a while ago about your coronary sinus, which is this part of the heart. You can see this one on your book. Your coronary sinus, ito naman yung nagdi-drain ng blood sa may myocardium natin. Okay? So lahat ng veins na maririnig nyo or yung mga vena cava or inferior, ganyan, usually they will drain blood. Now let's go here. How about the left side of the heart? Yung left side of the heart naman, it carries blood from the heart going to the body. Okay? Kanina, yung pulmonary, heart to the lungs. Itong systemic, heart to body. Okay? Kung kanina, blood is oxygen poor and carbon dioxide is rich. Dito naman sa systemic, blood oxygen in the blood is rich and carbon dioxide is poor. Okay? Is that one clear?
Yes, sir.
Okay, very good. So let's go here. Dito naman meron tayong left atrium. Sa left atrium natin, meron tayong 4 na opening. Okay, your pulmonary veins that will receive blood from the lungs. Okay, so meron tayong left ventricle here. Meron din tayong aorta. Okay, si left ventricle, this part here, they will open to aorta. Okay, so this is thicker, contracts more forcefully, and higher blood pressure than your right ventricle to get to the body. Okay, so mas malakas yung kanyang pressure compared kay right ventricle. Okay, si aorta, this one, ito naman, kasi from here going there sa aorta, it carries now blood from left ventricle going to our body system. Okay? So this one is a more comprehensive or more detailed view about the pulmonary valve, your atrium, your ventricle, your chordae tendineae. Okay, so here again, this is your superior vena cava. Then sa baba is your inferior vena cava. Here we have the chambers of the heart, your right atrium, left atrium, your right ventricle, and then your left ventricle. And then dun sa upper part again, we have your atrioventricular valves na dalawa. And then doon sa may lower part, meron din tayong valves. Okay, and then again, yung chordae tendineae, it will help the valves with the blood flow. Now let's go here. Ano naman ito? This one is the blood flow through the heart. Okay, so as you can see here again, wait lang, accept ko lang tong mga pumapasok. Now let's go back. As you can see here, the first one, the superior and inferior vena cava. Okay, this is the first one here. Then this is the right atrium. Okay. Now, in order for the blood to flow, it will pass through first here. Okay. So from your right atrium, it will pass through your tricuspid valve, and then the blood will receive by your right ventricle. Okay. And in order for it to move again, it will pass through your pulmonary semilunar valve here. Okay. Then it will go to the trunk, the pulmonary trunk, and then it will now branch out to your left and right pulmonary arteries. Okay? After that, ito na yung pupunta sa may lung area natin. That is your lung tissue pulmonary circulation. Okay? So after that one, here in number 5, this is now your pulmonary veins, and it will pass through your left atrium. Okay, in order for the left atrium, the blood here in the left atrium to pass through your left ventricle, dadaan siya dito sa ating bicuspid valve. Okay, bicuspid valve, then i-receive siya ng left ventricle here, number 7. And then, in order for it again to pass through, meron ulit valve dyan. Yung tinatawag natin na yung bicuspid valve kanina, and then bababa na dito number 7, punta ng left ventricle, and then your aortic semilunar valve. Okay, and that's the time na makakapunta na siya ng aorta, and then your coronary arteries, and then yung heart tissue. Ito na yung ating coronary circulation. And then dadaan siya ulit ng coronary sinus, cardiac vein, and then babalik ng right atrium. Or from aorta, here number 8, pupunta naman yung iba sa may body tissues natin. Okay? So ito na tinatawag natin na systemic circulation. So from the body, it will now go back to your superior and inferior vena cava, and then the cycle will do again and again. Clear ba itong diagram na ito?
Yes po.
Yes,
Okay.
sir.
Yes, sir.
So
Yes.
if you will just read this part of the on your book or here in this illustration, you will understand the flow of the blood on our heart. Kung saan yung mga dadaanan niya, kung paano makakapunta si kumbaga, for example, kung paano makakapunta si blood from atrium going to right ventricle, ano yung dadaanan niya muna? So ang dadaanan niya ay si tricuspid valve. And then hanggang sa pupunta na siya ng pulmonary semilunar valve, pulmonary trunk, and so on. So parang maze yung dinadaanan ng ating blood. And of course, kapag may mga damages dyan na nangyayari, especially doon sa mga valve natin, maa-alter yung blood flow natin. Okay? And if you have heart conditions or maybe yung high blood condition, nagbabago yung blood flow natin. Now let's go here. How about your blood supply to the heart? So as you can see here, kapag red, here there are your arteries, and then yung bluish, there are your veins. Okay, so as you can see here on the anterior view, we have your coronary arteries. So yung coronary arteries natin supply blood to your heart wall, and then originate from the base of the aorta, your aortic semilunar valve. So we have here your left coronary artery, and then meron din tayong right coronary artery. So if you're going to look at this one, on your left coronary artery, it has 3 branches actually. and it supplies the blood to your anterior heart wall and then the left ventricle. While here, your right coronary artery, which is this one, it originates on the right side of your aorta. And then sinusuplayan naman nito yung right ventricle ng heart. Now let's go here to letter B. This is your cardiac veins. So yung veins, it drains the blood from your cardiac muscle, and most of them drain into your, again, on this one, which is your coronary sinus. So most of the blood dito nadidrain. Now let's go here in your action potential in your cardiac muscle. So these are the changes in membrane channels permeability are responsible for producing action potentials and is called the pacemaker potential. Maybe you already heard about the pacemaker. There are artificial pacemaker kung saan nilalagay sa mga patients na may mga heart problem. Okay, so we have your depolarization phase. Your sodium ion channels open while your calcium ion channels open as well. So we also have your plateau phase. Your sodium channels close, some potassium ion channels open, and calcium ion channels remain open. Okay, so you can see here next, repolarization. Your potassium channels are open, calcium ion channels are closed. In plateau phase, prolongs the action potential by keeping the calcium channel open. In skeletal muscle, action potential take 2 millisecond. In cardiac muscle, they take 200 to 500 milliseconds. So as you can see here, please find this one on your book for you to understand more about this one, about the conduction system of the heart. Okay, I mean about the action potential of the heart. So let's go here. Conduction system, what is this one? This is the contraction of the atria and also the contraction of your ventricles by cardiac muscle cells. So, kanina na-introduce natin na yung sinoatrial, but this time this term is sinoatrial node o tinatawag natin na SA node. And they are usually in your right atrium. This is where action potential originates and functions as pacemaker. There are large number of calcium ion channels here. So as you can see here on this diagram, okay, sabi natin dito, nag-i-start yung action potential sa may AV. Tama ba? Ay, sa ating RA. Sa ating right atrium. So what is happening here is that the action potential, ito, it originates in the sinoatrial node, which is this one, and then it will travel across your the wall of the atrium. As you can see here, papunta siya sa may left atrium. And then from the SA, here, magtra-travel din naman siya dito sa may atrioventricular node. So SA, and then it can travel to left atrium, and here also sa may ating AV node. And then what will happen next, in number 2 here, the action potential pass through the AV node and then along the AV bundle. So as you can see here, ito yung AV bundle na tinatawag natin. And then eventually magbe-branch out tong AV bundle, magiging left and right AV bundle. And then magta-travel siya. So once na nag-travel siya here, yung end part, this one, this is now what we call your Purkinje fibers. Okay? This is also your Purkinje fibers. So this is how the conduction system of the heart works. Now your ECG, maybe some of you here already experience having or taking ECG of your relatives or na-try nyo nang na-ECG dati. So this is the record of electrical events in the heart, diagnoses cardiac abnormalities, and uses electrodes, contain P wave, QRS complex, and then your T wave. So ito yung parang yung kinakabit sa kamay, sa paa ng pasyente, tapos yung mga electrodes niya sa may body part, sa may chest area, para makita or malaman yung conduction ng ating heart. Kung yung pasyente ba is undergoing heart attack or mayroong there's something wrong dun sa electrical conduction ng ating pasyente. So you can see here now. So ito yung ECG natin, ECG readings sa ating pasyente. So technically, you can see this one. Once you see this kind of illustration, these are normal. Okay? So here, the first wave here, that is what we call your P wave. Okay, what is happening here is the depolarization of your atria. Now, here there are three letters, that is your QRS complex. Now, this is the depolarization of ventricle. This one. So, bababa siyang konti, and then magpipik siya, bababa. And then after that one, you will be having your T wave. Your T wave is the repolarization of ventricles. Okay, you will learn a lot more of this one in your medical surgical nursing and on your 4th year level. So we have here your cardiac cycle. Your heart is side-by-side pump, the left and the right. Your atria is your primer for pumps. Kanina sabi nga natin dito, minimal lang yung pump ng atria, but they start the pumping. While the ventricles, they are the power pumps. Okay? Your cardiac cycle, it's repetitive pumping action, which includes contraction and relaxation. Yung cycle, blood flow, we already learned that one a while ago. Cardiac muscle contractions produce pressure changes within the heart chambers. Pressure changes are responsible for the blood movement, and blood moves from areas of high to low pressure. Okay, so let's see this one. Let's see this illustration. So this one, this is the cardiac diastole. So you can see here, all chambers are relaxed and blood flows into the heart. So naka-relax lang ito. While here, this is what we call your atrial systole, and then your ventricular systole. So what is happening here is atria contract, pushing the blood into your ventricles. Okay, and the next one, your letter C, your atrial diastole, and then your ventricular systole. So what is happening here, nagre-relax naman yung atria. Pag nag-relax your atria, nagko-contract naman yung ventricles. Okay, so after the atria relax, the ventricle contract, pushing out of the heart. Okay, so this is how the pumping is happening in your atria and in your ventricles. So this one, this part, you can see this one on your book. Kasi masyadong maliit dito, but you will appreciate this one once you see them in your book, as well as this part. Let's go here, heart sound. Maybe some of you already have your BP apparatus. You already have your stethoscope. If you have Littmann is a very nice brand of stethoscope. Sobrang lakas at saka sobrang linaw yung pag narinig mo yung heart sound. Okay? The heart sound, stethoscope is used to hear the heart, and also the heart, hear the lung and the heart sounds. Okay? Just like this one. The first sound you will hear there is lub, and then dub. Okay? Lub dub, lub dub. sometimes meron tayong tinatawag na S3 sound. So S1 is love, S2 is dub, sometimes merong S3. Yung S3 yun yung abnormal. Yung may mga abnormal contraction, love, dub, dub. Parang ganun yung kanilang heart sound. Okay, but on normal, it's just lub dub, just like that. The sound result from the opening and closing of the valves. Okay, so paano, ano yung sound na naririnig natin? It is because of the opening and the closing of the valve. So we also have what we call the murmurs are due to faulty valve. Okay, maybe I can find videos for you to that I will be sharing maybe for you to appreciate more about the heart sounds. Okay, but with that, let's I'm gonna show you first the parts of your stethoscope. Maybe some of you here are already using this one. I think Atria is using this one already. She's working in the hospital. So the stethoscope here, the upper part where you put on your ears, that is what we call your earpiece. Okay, this one is removable. You can clean that one up. Okay, and then here, this is what we call your ear tube. Okay, so ito nabibend nyo ito. And then here, this is what we call the tubing. Yung nagkukonect ng earpiece going to this one. So this one is the stem. Then ito, yung sa may upper part, this is what we call the bell. And then diaphragm, ito. Ito yung pinapatong natin sa may pagkukuha tayo ng BP or mag-check tayo ng heart sound. Yung diaphragm part ng ating stethoscope. Okay? And saan nyo yung ilalagay here in order for you to hear properly? So we have here your pulmonary semilunar valve on this part of the chest. This is your aortic, this is your bicuspid, and this is your tricuspid. So if you're going to place the diaphragm of your stethoscope here, you can hear sounds. Okay, you can try this one later on after our class. And here, let's talk about the regulation of the heart function. So meron tayong stroke volume na tinatawag. Yung stroke volume of blood pump per ventricle per contraction. Usually, this is 70 ml per beat. Okay? Yung heart rate naman is number of heartbeat in full 1 minute. Okay? Sometimes may mga estudyante na nagta-times 2 na lang pag kukuha sila ng heart rate. Kumbaga hanggang hanggang 40 ay hanggang 20, then magta-times 2 sila, parang ganun, oh, yun na yung heart rate, but not. In order for us to accurately get the heart rate of the patient, it should be full 1 minute. Okay? Dapat hindi tayo nagsha-shortcut dito pagkukuha ng heart rate, pagkukuha ng respiration, pagkukuha ng pulse rate. Okay? Heart rate and pulse rate, full 1 minute. Now, here, syempre, paiba-iba tayo ng pasyente. If we have different sets of patients, they have also separate or different sets of normal values. So newborn usually is 145 heartbeat per minute. 6 months old is 120, 1 year is 115, 5 years old is 95, 10 years old is 75, and for adults, it's usually 70. You are considered adult already. So basically your base heart rate is 70, okay, or higher. But on a normal range, we usually get 60 to 90 or 60 to 80 bits per minute. Okay, so here it says that 72 bits per minute is the usual that we can get. Your cardiac output is the volume of blood pumped by ventricle in 1 minute. Okay, so basically your CO cardiac output will equal to your stroke volume times your heart rate. So makukuha mo na dun yung cardiac output. Okay, you can read this one on the page 335 of your book. Now here, let's talk about the intrinsic, from the word itself, intrinsic. It means inside or within. Intrinsic regulation of the heart. What is this one? These are the mechanisms contained within the heart. Preload, degree of which the ventricular walls are stretched at the end of your diastole. Your venous return, amount of blood that returns to your heart. Okay? So if venous return increases, your cardiac muscle will have a greater force, which can cause an increase in the blood volume of the heart, which again increase the stroke volume. Okay? And vice versa. Kapag mababa naman, of course, mababa din yung stroke volume natin. Now let's go here. A venous return, preload, stroke volume are related to each other. That is why kapag mataas yung isa, mataas lahat. Pag mababa yung isa, bababa din. We have here what we call the Starling's law of the heart. This is the relationship between preload and stroke volume. It influences your cardiac output. Okay, especially if you're doing a lot of exercises, it will increase our venous return, preload, stroke volume, and your cardiac output. Kapag tayo ay physically active, we go to the gym or we play sports or we do a lot of things na physically mataas yung ating venous return. Okay, the last one here, what we have your afterload. Yung afterload naman, pressure against which ventricle pumps must pump the blood. And here, kung kanina may intrinsic, meron din tayong tinatawag na extrinsic regulation of the heart. So what is this one? Mechanism external to the heart, nervous or chemical regulation. Okay, so this one, here, you can check this one on your book. So this is more of the extrinsic that is happening in our body. Next one here, the nervous regulation or the baroreceptor reflex. So ano itong tinatawag natin na baroreceptor reflex? These are the mechanism of the nervous system which regulates the heart function. Okay? Keeps heart rate and stroke volume in normal range. Kahit hindi siya part ng cardiovascular system, hini-help niya to regulate the heart function and making things in normal range. Your baroreceptors monitor your blood pressure in the aorta and also in the carotid arteries. Changes in blood pressure causes changes in frequency of action potentials, and this one involves your medulla oblongata. Okay, going here, you can just read this one on your book. In terms of the chemical regulation, your chemoreceptor, kanina yung baroreceptor, this one is chemical chemoreceptor. Chemicals can affect the heart rate and stroke volume. Your epinephrine and norepinephrine from your adrenal medulla can increase the heart rate and stroke volume. Excitement, anxiety, anger can increase cardiac output. Kaya kapag medyo excited tayo or galit na galit tayo or may anxiety tayo, tumataas yung ating cardiac output. Usually, ito yung nagtitrigger ng stroke sa ating mga nakakatanda na kasama sa bahay or kakilala. If it's too much emotion, they're on their peak of their anger, mataas yung cardiac output, pwede silang may stroke. Okay? Depression can decrease your cardiac output. So your medulla oblongata has chemoreceptors for changes in the pH and carbon dioxide level. Your potassium, calcium, and sodium affect also your cardiac function. Kaya in the hospital, with this kind of medicines na piniprescribe, dinodouble check namin ito mabuti and kino-confirm namin mabuti sa mga doctors or attending physicians. Doc, confirm ko lang, meron po ba tayong order na sodium chloride or calcium chloride or potassium chloride sa ating patient? If yes, sabi nila, oh sige. So that's the time that we will check the medicine. And then while the patients are taking this kind of medicine, we are also monitoring the levels of this one, yung blood chemistry ng pasyente natin, para alam ng doktor kung i-continue niya or i-stop niya or hindi na yung gamot once na nag-normal level na. It's because that is something to do with the cardiac activity of the heart as well. So this one, you can see this one on your book. Heart attack here. Okay, this one is the one I'm talking a while ago. So what we have here, your thrombus. Thrombus is a blood clot that blocks your coronary blood vessel. This one, it will cause the heart attack kasi yung flow ng blood natin is not consistent. Kumbaga may blockage. That is the thrombus. So daily aspirin can prevent by thinning the blood. So we have here the infarct, or sometimes we call it infarction. This is the area that dies because of the lack of the oxygen. Okay. Your heart procedure, we have your angioplasty. Procedure opens blood vessels. Then meron din naman tayong tinatawag na stent, yung structure inserted into your blood vessels to open. And we have your bypass surgery. Bypass is procedure reroutes the blood away from the blocked arteries. Kumbaga, naghahanap ng ibang daanan para yung flow ng blood sa ating heart is normal. Okay, so these are your heart procedures. Okay, are we good so far?
Yes,
Yes,
sir.
sir.
Okay, and then I think that's the end of our chapter 12. Let's have a quick break and let's finish the discussion by 3 p.m. Okay?
Okay, sir.
Yes, sir.
Okay, sir.
Okay, sir.
Okay, so I'll see you then by 3 p.m. Same link. Let's have a quick break first and then let's go back para matapos na natin ito. Okay?
Yes, sir.
Okay, sir.
Yes, sir.